Hello and welcome to Easy Nursing Guide. Are you preparing for the NCLEX-RN or NCLEX-PN exam? Feeling confused about what to study? Don't worry, I've got you covered. Today, we'll break down the entire NCLEX content in a super simple and easy way. So let's get started. What is the NCLEX? The NCLEX is a licensing exam for nurses in the USA, Canada, and Australia. There are two types. NCLEX-RN for registered nurses. NCLEX-PN for practical nurses. It checks if you're ready to work safely as a new nurse. NCLEX is divided into 8 major categories. Let's explore each one with examples to make it fun and easy. 1. Management of Care and Coordinated Care, PN. This is about being organized and safe in your nursing care. Topics include prioritizing patients. Who needs care first? Delegating tasks to the right person. Patient rights, informed consent, and HIPAA. Case management and referrals. Example: if one patient is bleeding and another has a fever, who should you see first? Safety and infection control. This section teaches how to protect your patient from harm. Includes hand hygiene and PPE. Isolation precautions, contact, droplet, airborne. Patient identification. Fall prevention and emergency safety. Tip: always think safety first in NCLEX questions. 3. Health promotion and maintenance. This is about preventing illness and promoting wellness. Topics include growth and development, baby to elderly, prenatal and newborn care, screening and health education. Example: what advice would you give a pregnant woman about nutrition? Psychosocial integrity. This covers mental and emotional support. You'll learn about mental health disorders, therapeutic communication, grief and stress, abuse and neglect. Example: what's the best way to talk to a patient with anxiety? 5. Basic care and comfort. Think daily care. This section includes feeding, bathing, dressing, pain management, positioning and mobility, oral care and toileting. Tip: know how to comfort and assist patients in daily tasks. 6. Pharmacological and parenteral therapies. This one is all about medications. It includes how to give meds, IV therapy and injections, drug interactions and side effects, dosage calculations. Remember, 5 rights of medication: right patient, drug, dose, route, time. 7. Reduction of risk potential. This focuses on preventing complications. PICS. lab values like potassium, sodium, post-op care, monitoring equipment, chest tubes, catheters, recognizing early warning signs. Example, what does a low potassium level mean for the heart? 8. Physiological adaptation. This covers body responses to illness. Medical emergencies, shock, CPR, seizures, fluid and electrolyte imbalances, acid-base balance, diseases like diabetes, asthma, end-of-life care. These are often priority questions. Learn to spot danger signs. How the NCLEX works. The exam uses computerized adaptive testing, CAT. That means the questions change based on your answers. More correct answers, harder questions. You'll see different types. Multiple choice. Select all that apply. Fill in the blank. Drag and drop. Audio and image-based questions. You have up to 5 hours to finish, but it might end early if you pass or fail clearly. Top study tips for NCLEX success. Want to pass on your first try? Use these smart tips. Focus on concepts, not just memorization. Practice select all that apply daily. Learn ABCs, airway, breathing, circulation. Master drug names, lab values, and emergency care. Take regular mock exams. Your goal isn't to get every question right, it's to prove you're a safe nurse. Wrap up. And that's the full NCLEX content made super simple. If you found this video helpful, please like, share, and subscribe to Nursing and NCLEX Easy Nursing Guide. We'll keep bringing more easy, fun, and bilingual nursing content just for you. Good luck on your NCLEX journey. You've got this. Please don't forget to subscribe this channel for more nursing content. You said, as I upload